Well, good afternoon, everyone. This is Steve Mondernach with the Association of Food and Drug Officials. We will be getting started here in just another minute or two. We're giving folks a few more minutes just to get through the login process and get in attendance at the webinar. We thank you very much for joining us today, and we'll get started here in another minute or so. Okay, well, looks like our still see a pretty solid number of folks joining us, so we'll just wait just a few more seconds till we start seeing a slowdown of people logging in and get started here very shortly. Okay, well, let's go ahead and get started. First, welcome all of you to today's webinar, Pandemic Prepared Certification, Building Business Resiliency for COVID-19 and Beyond. We are excited to do this webinar jointly with our colleagues and friends at AIB International. And we're going to begin here just with a little bit of introduction to who the Association of Food and Drug Officials are. I am Steve Mondernach, and I'm the Executive Director of the Association of Food and Drug Officials. We just wanted to give you a little welcome to the association and a little introduction. Amy, you want to go to the next slide, please? So the Association of Food and Drug Officials has been in existence since 1896. For those of you that are history geeks, you'll know that predates the precursor to the FDA by about 10 years. We actually are one of those few groups that are still in existence today that can say that we lobbied for the formation of the first federal food safety agency and worked directly with Dr. Wiley for its founding. So kind of a unique position in history. In addition, we work very hard to connect together food and medical products professionals in both the public and private sectors, provide a forum for sharing various disciplines and perspectives with the goal of impacting the regulatory environment to protect health, welfare, and the global community. As we noted, today is a good example of that, talking a little bit about what can be done for pandemic preparedness in the food industry. Let's go on and move to the next slide, Amy. In addition, we have lots of resources available that may be helpful for those, whether they're in regulatory or the food industry. One thing that's available is our mobile app. The mobile app does include some important things, such as if you go under contacts, you can find all the regulatory officials across the country by their program areas. So if you need to find the manufactured food program leader in Kansas, for example, you can search right there under contacts, look at Kansas, and you'll be able to find that individual, their phone number, and their email address so you can contact them quickly. Same thing with retail foods, produce safety, milk or dairy programs, shellfish, all of the major food safety components, meat and poultry also. So in addition, the food emergency response guide is located there. So if you get in a unique situation and wondering, how do we do this? There are some good pieces of information there, along with a bunch of other great guidance documents. In addition, I just do want to point out that AFTA does a weekly podcast on various topics. Everything from Deputy Commissioner Yanis from the FDA talking about the smarter era of food safety to learning more about what's happening with Feeding America and their programs across the country. So wide variety of information available there, comes out every week. Great opportunity to take a listen as you're commuting to your home office or maybe to another location, or when you have a little downtime, definitely take a look at those podcasts. Let's go ahead and move on, Amy. In addition, we always mention this for you all. We do have the Directory of State and Local Officials, like I said, is on the mobile app. It's also on the website at dslo@afto or dslo.afto.org, where you can find those regulatory contacts that you need across the country. If you just select the state, you'll see everything you need in all the program areas listed, so you can find exactly who you're looking for. Move on, Amy. And then lastly, I do want to just point out that there are lots of potential regulatory meetings that AFTA does host across the country that may be of interest to you. Coming up on June 12th through the 16th, 2021 in Grand Rapids, Michigan will be our annual conference. We're really looking forward to that. That will actually be our 124th annual conference. So very excited about that meeting coming up. And then we have regional affiliates across the country in the western part of the United States, the middle part, the north central part, central Atlantic, and then the southern region, and then there's and the Northeast, who actually is not having a meeting right now. And this is their normal meeting times and locations. But just a heads up in case you're interested in learning more, we'll be happy to get you some more information, and just drop us an email at afto@afto.org. I think that was the last slide, Amy, and there is my contact information if you'd like to learn more about us, or afto@afto.org. Take a look at our website, and yeah, you can learn more about us also. Once again, I'm very excited to introduce our first presenter today. Steve Robert is the Global Vice President, Sales, Marketing, and Innovation at AIB International, and is leading the team that developed the Pandemic Prepared certification. Steve has held leadership positions at EcoSure and leading food equipment manufacturers Cornelius and SureShot Solutions. Steve brings extensive food industry knowledge and relationships globally, and has a proven track record of delivering results that allow organizations to successfully enter critical emerging markets. Please join me in welcoming Steve.
Steve, can you hold on for just one moment? We're getting a lot of folks that are saying they don't have audio. So can we make sure, if everybody can hear me, can hear this message, if you could please acknowledge, because we do have more than one or two saying they have no audio. Steve, it's all yours. We're all set. Thank you, everybody.
Thank you, Stephen, for the introduction. I really appreciate that. And more importantly, thank you so much, AFTO, for hosting this webinar. We really appreciate the support. AIB International is extremely excited to present Pandemic Prepared certification. It's the first certification created specifically for the food and beverage supply chain that really elevates critical planning for people, facilities, and production inputs. And depending upon performance, can really deliver some significant social impacts, build resiliency to the bottom line, and unlock some insurance benefits. I'm particularly proud of how we leaned in from a research and development perspective, but also the implementation methodology for the initiative. We put it to the test with thought leaders from industry, government, academia, insurance companies, and some of the world's most recognized brands to ensure this truly exemplifies a global benchmark that is proactive, practical, and provides tangible benefits. I'd like to introduce you to Judy Lazaro from my team, Senior Category Director of Food Safety, to tell you more about it. Then we'll close with a message from my boss, Andre Bion, President and CEO of AIB International. Judy, please take it away.
Thank you so much. And I do hope everybody can hear okay. I think it's hugely important that we spend some time together, that we make sure we can interact. And how we do that, before I give you a little more introduction, I want to make sure that everybody is familiar with the whole webinar process. There's nothing worse than listening to a person talk for 30 minutes or 35 minutes without being engaged. So the best way for you to be engaged on a webinar like this is in that little box on your screen that says questions. And many of you have already wished me a great day, and for that I'm grateful, because we have a lot of you on the line. So I admit I'm a little bit nervous. So it's always great to feel like you're not alone by folks interacting in that question box. So please, we are going to answer every question at the end of this web session. And more importantly, how we do it is we do not identify who's asking the question. So don't think, oh, I don't want to ask this. I don't want anybody to know I'm asking. Your questions are read without the author. I'm also very excited to tell you that I am not going to answer the questions alone. I'm going to be joined with our technical expert, which is Peg Ray, who has a lot of years experience in the food industry and has really been our expert, our subject matter expert on this topic. And then before we get to the question and answer, I am very pleased to introduce Mr. Andre Bion, who's just been he's the president and CEO of our organization and has been phenomenally supportive of what we've done. So having said all that, we're about ready to get started. Again, thanks so much, everybody, for your support. It is a full house, which tells me that there really is a need for what we're going to talk about. And I think, once again, AIB International can provide, as a service provider, we're going to provide you some solutions. For those of you that may not be too familiar with AIB International, first thing I want you to know is we are a global company. Sometimes people think of us as North American or US centric. We're absolutely not that. We're in 126 countries. And that number, quite frankly, increases every single year. So, it might be 126 right now, but next year it's probably going to be 128 and so on and so forth. Bottom line, we're a global organization. We, unlike AFTO, we don't have the longevity as AFTO. We're almost rookies in the field. We only have 100 plus years, 101 to be exact. We're 101 years young, and I want to point that out. And I say that with only a little bit of sarcasm. We are a 100-year-old company, but we're young because we're innovative. And I think what we're going to talk about now is truly going to demonstrate that. Many of you know us in the industry as the global leaders in food safety. And that is one thing that's unique about our 100 years. There's other companies that have 75 years and 25 years, and you say, what makes you so much better, Judy? So what? What's so unique about AIB International, it's all we do. The only thing we do is food. We are a food organization. For 100 years, we've supported the food industry. And we've also, like AFTO, we also lobbied, we way back in the day had that same relationship with Dr. Wiley. So I'm very pleased to tell you that, it is truly food as a whole is in our blood. So it should be no surprise that the industry started to come to us aggressively this year when we started with this pandemic. And we're going to talk about that and talk about the reason why. If there's anything on the screen, I do want you to read. It's the last sentence, and it says, inspires the food industry to apply the highest integrity standards. I think that's hugely important. And, I've been with AIB for a very long time. And one thing that I always think AIB International equates with integrity. I think it's everything we do is integrity. So again, if you take anything from this screen, please recognize that, because I think it'll be illustrated as we move forward. So we did learn some new languages this year, some new words rather this year. As a food safety professional that I am, I know words like product zone, product safety, product area, but we learned some new words. We learned touch points. That was a new one. We learned pandemic. Truly, we all know what the word meant, but how many of you used it in a sentence up until this year? And certainly you didn't use the word touch point. We do have a new vocabulary this year because we have new issues this year. And if you look on the screen, COVID-19 really, truly took the food industry by surprise. And let me give you some examples of what I mean by that. Crisis management, everybody in the food industry, we have a crisis management program. But how many of you didn't have pandemic in your crisis management program? Probably the majority, because our crisis management program was food focused. Now let's talk about supply chain disruption. We're used to running long hours. If you're a potato chip plant, for example, or a snack food plant, you tend to run more around the 4th of July holiday, right? Because, we're seasonal. So we can anticipate when we're going to be busy and when we're going to be slow. Boy, we had a lot of supply chain disruptions this time. We had facilities that weren't used to running at 110, 120, 130% capacity. All of a sudden running at 30% with 30% less employees. So, truly, these were real challenges that faced the industry. Intermittent operations. Again, we went from companies that maybe had 50 SKUs down to 25 SKUs because they maybe didn't have the ingredients that they needed. They couldn't get it through their supply chain. So you can see already, I'm probably sure that many of you are kind of nodding your heads saying, that was us, that was us. I'm going to skip cleanliness and sanitation for 1 second. We'll come back to it. Let's talk about worker health. So when we talk about, every one of us out there has commitment statements in our facility that said food safety is important to us, and we also say employee safety is important to us. Who doesn't have that somewhere in their facility posted that says employee safety is number one? It's critically important to us in the industry. But we also, when we think of employee safety, worker safety, we don't usually think of health. We think of sprains, strains, soft tissue injuries, cuts, bruises, back injuries. We don't typically think of viral transmission. So again, these are new things for us in the food industry, and they're challenges. The last thing that I want to touch on is something that I'm actually going to read to you. So cleanliness and sanitation, prior to COVID, let me read this number for you. Sanitation and cleanliness was the #1 consumer concern regarding food and food safety prior to COVID. After COVID, that number went up to 41% increase. So a 41% increase in consumers when they think about what's going on in the food factories. First thing that comes to mind, cleanliness and sanitation. But we're doing cleaning and sanitation a whole lot different than what we did pre-COVID. So we're going to talk about some of these challenges. So I share all of this information with you because it's no wonder with all of these challenges that the industry turned to AIB International, the service provider. They know we've been there for 100 years. We've always helped the industry out, and people called us routinely saying, you got to help us. And we did what we thought was right. What we did was started conducting webinars at no cost at all, because should not be, information that we're not sharing. We absolutely shared the information. We also put together a checklist. But one thing that we noticed when we started really, as Steve said, leaning in, we noticed there is so much information out there there's so much on COVID that we started to feel almost overwhelmed. And we said, you know what? One, how much of it is factual? You have to separate what's really and truly factual and what's misinformation. So we started doing all of that, and we said, we can't do this in a checklist. We need to develop a standard, a true standard, something that will, be off the shelf, ready for the industry to take and move forward with, a proactive tool that the industry can embrace. So I say that because what started as us expanding a checklist turned into something completely different, and it's certainly something much more robust. So let me explain how we did it in some detail, because I think this is important for you to recognize that we absolutely use thought leaders amongst the world, not North America, amongst the world. So as I mentioned, we did a tremendous amount of research. We did not limit our research just to CDC, which I know many of you have limited your research to just CDC. Fantastic. It's not saying we didn't. We absolutely took advantage of all that brilliant information, but we also looked around the globe. We looked at information from New Zealand, we looked at Canada, we looked at EU countries, we looked at India. I mean, truly, to name only a few. We really did our research. Then we took that research and we said, let's find out what the industry is doing. How much of this research has life? So then we started with interviews of global companies, and we interviewed them in North America, and we interviewed them in France, etc. I mean, we truly, when I say global, I'm not exaggerating. We interviewed boots on the ground around the world and asked them questions about their crisis management program, about their pandemic program, about how they're handling the crisis, where they're getting the information. And then we went one step further. And I have to say to all of the folks out there that supported us, again, a special thank you. We had companies that were willing to share with us their plans. They said, you know what, Judy, if you want our crisis plan, here it is. In fact, we would be grateful if you told us what looked good and what didn't look so good. And when we noticed, when we started putting everything together, we would say, you know what, this company has a really good plan, but it would be better if they just added this. And then we looked at the next one and we said, this company has a really good plan, and gosh darn it, they got some great best practices. And we started putting things together. And while this was all going on, we're also going outside of the food industry, and we started working with insurance companies as well, because there's so much information here that we need to figure out, is this of value to, obviously what we're talking about, but is there a value that we're not seeing? So when I say we did our homework, we truly did our homework. The methodology we used was sound and solid. Okay. Then this is the part that I share with you, because now I understand what it's like to be on the other side of an inspection. What we did was we put everything together. We put it into a standard. We were proud of it. It was beautiful. I mean, the I's were dotted and the T's were crossed, and it was as perfect could be. So what did we do? We sent it back out to industry, including AFTO. And again, a special thank you to AFTO for allowing us this audience. AFTO reviewed it amongst a lot of other industry experts. And they came back and they said, yeah, it's really great, but for this. And, it needs a tweak here. And this I was not dotted. And you said this T was crossed. It really wasn't. I know what it's like now to be on the other side of an inspection. When we come in and you're ready, and then we say, you're really ready, except for the peeling paint over there. And you're really ready, except for the water hose over there. I know what it's like to be criticized. And let me tell you, it was a tough spot for us to be. But just like you, when you go through an inspection, it made us better. We learned from the comments, we respected the comments, and again, to use Steve's term, we leaned in hard and we made the corrections, we made the updates, and then we put together what we think is the final global standard. And I am absolutely, and I've been with the company a long time, I present this to you, and I'm truly very proud to have been part of this team. It is the Pandemic Prepared Certified, and it is that there's the mark. That's what the mark looks like. It is absolutely the first most comprehensive standard of its kind. Now, there's other things out there that you can find. There's checklists, and you might find an addendum. There is nothing yet that goes into the detail that we have gone into in this standard. It's truly designed to elevate critical planning. It focuses on people, facilities, and production inputs, all things that are hugely important to us. Okay, so again, pretty proud of that. We refer to it as the PPC. So again, if that, you say, well, that pandemic and it's hard to remember, it's the PPC. I mean, if you say that, we'll recognize it. So let's talk about some of the benefits, because this is really, after all, I think why everybody is tuning in. And if I told you how many were online, you'd be overwhelmed. It tells us that there really is an interest because there's really a need. And I will give you some very specific examples shortly on some of the information that I can share on some of our tests that we've done. So again, what's unique about this, it is specific to the food and beverage supply chain. We do have unique challenges in this industry. Let's be honest. We have a product that has a shelf life. I mean, that alone makes us different than a lot of other manufacturers. So, and if we do something wrong in our business, a lot of people are going to be impacted. So it is definitely important that we recognize the uniqueness of the food and beverage supply chain. I use the word proactive, and to me, it is a proactive and practical standard. It is absolutely intended so you can pull it off the shelf, use it, live by it, say, this is my guidance, this is my tool. I can use this, and this will, if I follow it, it'll make me a better company. Again, that's what I mean by proactive and practical. It's been vetted, and I think I explained how we did the development on it. But what I also want to share is we've tested it. And again, big thanks, huge thanks to those organizations that have allowed us to come in and challenge their programs, their systems, and really, in a lot of cases, we overwhelmed their resources. So a special thank you to all those groups that supported us. But that allowed us to say, you know what, it is a vetted product, and oh yeah, it is absolutely auditable. It is something that we can audit against and audit to. You notice on the screen it says proof of commitment. Let me make this so it's simple to understand. Proof of commitment means this is not, and I'm going to say it again, this is not an easy standard. So please don't think, oh, I have a pretty good program, I'm almost all the way there, I'm gonna try and go for this certification. This is not for a mediocre program. This is truly designed for the best of the best, what I call the Bobs, the best of the best. You have to have robust programs and systems in place that are executed. So you can't just say, I have all the documentation. You need to be able to show and truly say, I talk the talk, I walk the walk. Okay. And then there's some insurance related benefits. And I say this, and everybody knows me, I am a passionate food safety professional, very passionate about food safety. I am not an insurance broker, and I am not claiming in this conversation to be an insurance broker and expertise in this, but I do want to share with you some information I think that's pretty useful. So if you remember that, when I said at the beginning, we did a lot of research, and some of the research we did was with insurance companies. I want to provide some information from that research. So, for example, if we use data from just the month of April, not too far ago, just the month of April, if you had one employee in your facility that had to go to the emergency room, okay, to the ICU unit for COVID-19, just taking this example, the cost is $41,000 to $107,000. Okay, pretty significant, right? Now, let's talk about business continuity. If you have that COVID positive employee in your facility and you do not quickly, and I mean quickly, isolate, contain, and effectively resolve the issue, the consequences are severe. And for me, the consequences are significant because I don't want employee A making employee B sick. I don't want employee B making employee C sick, but also put a dollar value to that. It's hugely significant. We also have to keep in mind that workers' comp, employees do have the right, they absolutely have the right to file claims if they believe a company is negligent. So what a fantastic way to demonstrate that, you are doing what needs to be done. Having a robust pandemic plan certified by an independent third party. That's pretty impressive. And that's really what you want to do. But again, you want to make sure that you have strong programs. You want to be able to demonstrate that you are absolutely best in class. And that's the information that may yield you a better risk profile with your insurance company. So again, not an insurance expert, nor do I want to be an insurance expert. But what I am, because I'm pretty excited about doing the work that I do, but what I am telling you is have that honest conversation with your insurance carrier. So now let's take a look at the standard, because this is, I think, what everybody is waiting for, like, okay, what's in it? What's in it? And what do I need to do to get better? So you'll notice it duplicates with some similarity the slide that I said at the very beginning, that when we started receiving phone calls here at AIB International, people called us and said, oh, I'm having problems with this. These are the 5 sections, and let me talk about them. Pandemic crisis management. All right. And as I mentioned to you, um, our plans, we have crisis plans, but they were specific to food safety. All right. So this is a pandemic crisis management. Number 2 is supply chain management. Number 3, intermittent operations planning management. Number 4, instead of just cleaning and sanitation, it's prerequisite programs. And we're going to go through each of these in some detail, right? And then number 5, health crisis mitigation and management, right? So again, let's go through each of these. And I'm going to give you some touch points on each of them, or some bullet points, I should say, on each of them. And then I'm going to tell you from our experience some of the watchouts. And again, I hope you take this information, take it back to your facility and challenge your facility. Really challenge your facility and say, how am I doing? I mean, I think I have a good program. After all, I'm passing every inspection. I think I have a good program. Well, see if you can answer that question when I'm done with some of the examples. So pandemic crisis management, do you have a written plan? And do you regularly review that written plan? Have you done risk assessment? Have you created actionable items, and do you test it? Here's what our data, our research, and our site visits showed us. We found this was significantly gapped, because what we found, again, was not only did facilities have crisis management plans that did not include pandemics, again, very specific to food, but what we found was they were not routinely meeting. In fact, on more than one occasion, the last time the crisis management plan team, actually sat down together and had a meeting was before the pandemic. So how effective do you really think your crisis management plan is when you're not even responding as a team to a pandemic? So again, this is where I want you to listen and go back to your facilities and challenge, really challenge yourself. And don't just do the, I think we're okay. Challenge it, really challenge it. Supply chain management. This defines procurement responsibility. So did you ever think we would have a problem procuring raw materials and packaging? Heck, we had a hard time just getting PPE, right? So we weren't prepared for this. In fact, I would use the word we were ill prepared for this. But here's some other gaps that we saw. One example would be we'd say to the facility, who handles your procurement responsibility? And they'd say, Stephen. Would say, okay, if Stephen were to win the lottery and not show up for work tomorrow, now who handles your procurement responsibility? Silence. Okay, we rely typically on an individual, maybe two individuals that handle our procurement. And if that person just isn't there, perhaps is sick, all right, the program should not fall apart. The program needs to continue. So we saw that immediately as some gaps. We also saw another real gap, and that was, we have all facilities have what's called a supplier approval program. Every one of you out there that manages a facility, you have a supplier approval program. Here's what we found. Companies started bringing in things like sanitation chemicals, because of the COVID. They started bringing in sanitation chemicals. They started bringing in PPE. Never once did they follow their supplier approval program. And what happens is you go into panic mode and you forget all of the rules and you say, you know what, I really need to get this sanitation chemical. It says it works. I really need to get it. And you start purchasing it. Your procurement folks start purchasing it without benefit of the supplier approval program. So it makes sense that you have a procurement person on your crisis management team. So, the linkage should start to begin right now. Intermittent operational planning management. This was a big issue because, again, most of us are used to a facility running at 90%, maybe up to 110% capacity, at a particular time of year. What we weren't used to seeing is running at 110% capacity with 30% less employees. Or what we didn't expect to see was our business drop off 75%. So now we're operating at maybe 25, 30% capacity simply because we do not have the workforce. So instead of running 5, 10, 20 SKUs, we're running 1 or 2 SKUs. So what this section really outlines is, how do you run during a crisis? How do you shut down successfully during a crisis? How do you start up during a crisis? And again, proactive, practical. Biggest thing for this is, we saw that facilities did not know how to handle the no people. I mean, that really caught the industry, the food and beverage industry, by surprise, and also never thought about raw materials, especially ingredients. Okay, not just packaging material, but specifically ingredients. We never thought about expiration dates. So again, these were real issues that the industry has faced and continues to face. The next section is health crisis mitigation and management. So this is where you say, okay, we do health checks, and all of you are doing that at your facilities. We have PPE now. Everybody comes in and they wear masks or they wear shields. I mean, whatever your PPE requirements are. And then we have mitigation measures in place when, if there's an issue, and if there is a positive, we have steps in place. And we think we're doing things really, really well. But some of the challenges that I would task you with. What happens, for example, if somebody comes in and their temperature is very high, exceeds whatever your minimum threshold is? Do you send that person immediately home? Or do you say, why don't you sit in the break room? Why don't you go back out to your car in the air conditioning and let's see if that temperature goes down? So again, these are real things that are happening, and you have to ask yourself, are they the right things that should be happening? The other issue with the PPE that we saw, again, we're all very used to seeing face masks now, but how do you handle a face mask? There's a specific way of putting one on and taking one off. Donning and doffing should be very specific procedures. You always want to treat that mask as if it were contaminated. So that means you don't want to just let it sit on the break room table. You certainly don't want to just maybe share one with another employee. I mean, there's a real protocol on PPE. So let me give you something for my food safety friends on the call. We have an issue where we say we're not going to let an employee take their jacket, for example, wear it outside the factory, come back in and hang it next to the product line. We would never be okay with that, would we? We would never be okay with that. We'd say, nope, Not okay with that because we can't control what that employee does at home. They may have a lot of animals. They may have, pest problems. We don't know. We can't control it. So we say, you know what, if you bring that outer garment back into the facility, you have to put it in a specific area. But now let's switch that around. How many of you are allowing employees to wear their own face masks? Maybe it's their, a team sport, a sports logo on there or something like that, that they're allowed to work, take it home, and they're allowed to bring that back into their factory and then do what? Work on the production line. So this is where you got to stop and say, well, we're doing that in our factory, and ask yourself, should you be doing that in your factory? So again, some of the biggest watchouts that we saw were just poor handling of PPE. Okay. And then this section is the prerequisite program review. And this was a big, big section and continues to be a big, big section. So one thing that we saw, we all know, in addition to the new words that we learned during this pandemic, we saw a huge reduction of employees. Let's be honest. We had, in some factories, the workforces were cut in half, almost to 50%. So how are you effectively running those lines? How are you effectively cleaning those lines? How are you effectively receiving all that product if you have lost all of your key employees? So that's why it's important, again, very, very important that you challenge your prerequisite programs. And I'll give you some examples. So a lot of us decided that we were going to put diverters in between, separation barriers in between all of our employees in our factories. So, instead of you and I being within 3 feet of each other, we put a partition. But did it ever occur to you maybe not using a brittle plastic? So instead of putting in a Lexan, for example, which is a non-brittle plastic, what did we do? We hung plexiglass. So now what we've done is we've eliminated one problem, okay, and that's the employee health issue. But we've created now a food safety issue. So that's why it's so important that we challenge our prerequisite programs. How about IPM, Integrated Pest Management? A lot of us thought it was better to keep doors open, so then we don't have employees touching the door handle. So let's keep doors open. And oh yeah, the pest control industry was not essential for a lot of us, so we stopped the service. How effective now is our integrated pest management program? So really, the takeaway from this is, if the food safety culture is really strong and optimal, and I will, I think when it comes to food safety culture, Deputy Commissioner Frank Yanis and myself share this huge passion about food safety culture, and I hope most of you share the same passion. It definitely was impacted by COVID. So let's make sure that we're challenging our programs. We're really looking hard at our programs. And another watch out for you that's not on the screen that I want you to pay close attention to when you challenge your prerequisite programs, please look at your food defense program also. So again, here's the standard. Now let's talk about the inspection. So I went through each of the categories. I hope you understand. I hope you got some value and you're like, yep, I need to do better in my facility, because again, that's value added. If you can walk away from this web session and say, you know what, I do need to challenge that, then for you and me both, it was a good day. Okay, so let's talk about the inspection itself. So to achieve certification, you have to do well in all 5 sections. So what I mean by that is, you can't say, I have a fantastic pandemic crisis management program and my supply chain is strong and everything's great, except for the rodent problem I have in my facility, I'm pretty good. You can't say that. You have to have at least 80% in every category, and your overall score has to be 90% to achieve certification. Now, I do think today is opening day for baseball. I do think so. So I have to give you at least one baseball analogy, and that is, of all of the training that we've done and all of the pilot tests that we've done, and we've done tests in some of the best companies on the planet, truly the best companies on the globe, we did not have a single company that hit a home run. And that's the honest truth. So when I tell you that everybody needs to challenge their program, everybody needs to challenge the program. We are not as strong as we think we are. So please go through each of these components and really, really do the challenge. And when you can go through this successfully, and you really, can go through this and you say, I'm ready, then take advantage of having a training evaluation, because we will do a training evaluation for you. In fact, I encourage that first. Try and do a training assessment and do that. And then if you think you're ready, then absolutely try and achieve that certification. And at the end of it all, you will most definitely have what I said at the very beginning about our integrity. If you can do phenomenally well on this, you will absolutely provide your employees, all of your employees, your insurance companies, and really the food and beverage industry in general, that you have the highest standard of integrity. All right. So what's next? Well, how soon can I get certified? Well, I think that's a question, as I said, I'd encourage you to start, internally, go back to your facilities and really challenge yourself and say, are we as good as we think we are? I mean, did we think about this? And have we really thought about that? Do that first, really do that first. And then if you have questions for us, our technical staff, if you have questions on how to get started, we have a dedicated email, and it is ppc@aibinternational.com. And we have a person, Tatiana, who is there to answer your questions, help you out. Her job, as I always say, her job is to help you pass without ever stepping a foot in your facility. Her job is to help you, truly help you, and give you the guidance. And again, so you got to make sure you take advantage of that site. Before I open it up to Q&A, I do want to turn it over to our president. I think Andre Bian has been a phenomenal leader during this, and I really would appreciate his comments. So Andre, if you are okay to take it over before I open it up for Q&A, it's all yours.
Thank you very much, Judy. I'd just like to say I want to give a big, hearty thank you to Steve Mandernack and AFTO for hosting today's session and allowing us to share with you the information about the Pandemic Prepared certification. As Steve Robert and Judy Lazaro have mentioned, this certification has generated a lot of interest from multiple stakeholders in the food and beverage supply chain, and we're excited to have given you a first look at our innovative approach. AIB International is committed to partnering with you to help you uphold your food safety and quality programs through this pandemic and develop innovative solutions to address your emerging challenges. Through inspections and consulting, certification services, customizable training, and regulatory assistance, our global team of professionals is committed to helping our customers address their specific challenges at every link in their supply chain. Now we'll open up the webinar to your questions. So Judy, what do we have coming in from the audience?
Thank you so much. And I really appreciate that. I'm going to leave this slide on if that's okay with everybody. The other slide is just me saying thank you to everyone, but I want to make sure everybody has that email link. And we do have a lot. I won't mislead you. We have a lot, and I'm going to do my best to, I'm going to ask Peg if you could join. Peg, I'm going to direct most of these questions your way. As I mentioned at the beginning, we had a core team that worked on this project, and the core team is almost as old as AFTO. When you look at the core team that did it, let's just say the core team has more than 100 years experience. We'll just leave it at that. And then for anybody that was wondering, this picture of me at the beginning, that was my high school picture. I just want to make sure y'all recognize that. So let's open it up. Peg, I have a question for you. Will AIB be adding this to the standard? And I'm going to interpret that. So if I'm wrong to the author, if you can tell me if I'm wrong. I think what they're asking is, will AIB be adding any of this to our current consolidated standard for food safety? I hope that's but if I'm wrong, please enter that in, okay?
Hi, everybody. No, we thought this topic was way too big to be bullet pointed into our current standard. So we developed the criteria into a standalone standard. This allows us to be able to measure how prepared you are to work your way through that event, that pandemic event. So we're not going to put it into our current standards.
I'm going to take the next question, Peg, because it's easy. See, I take the easier ones. This one says we're already SQF certified. Does that count? Well, that's fantastic. And I'm thrilled that you're SQF certified, if you're FSSC certified, if you're IFS certified, all of that. It's fantastic. It really is. This is completely different than that. And please understand, okay, this is specific to the categories that we just talked about. So this is not a food safety standard, nor is it a HACCP program, nor is it a food safety plan. Although it touches on those components, that's not what it is. So I know I gave you a long answer. The short answer is no, having that SQF certification is not going to help you with the pandemic certification. May certainly help you with the prerequisite programs, may certainly help you with some of the foundational programs, but it's different, okay? Another question, Peg. See, the hard questions go to you. Is this COVID-19 only?
Okay, well, COVID-19 was certainly the catalyst for us to think about going down this road to develop the standard. And there are references to COVID-19 in the standard. But the risk assessment and the mitigation strategies that are contained in this standard will help you prepare to any pandemic that comes down the road.
The next question is an easy one, Peg, so that means it comes to me. How often should a facility get certified? Well, you actually will be able to use that mark, that mark that I shared. So there is an expiration on the mark, and it is 1 year from your date of certification. Now, again, I would work with your insurance carrier. Your customers may tell you something different. They might be okay with it 18 months. You might also have someone says every 6 months. But for AIB International, the mark, you'll be able to have the use of that mark for 1 year when you successfully certify. Peg, this one is asking specifics about the length of time.
The audit is set up to be a 2-day event. And don't get excited because only the first day is where we tie up your team. Whether it's on site or done virtually, your team only needs to meet with us for that first day where we go over everything. The second day is done off-site, and that is for the writing of the report and also the technical review of the report for accuracy. So it's a 2-day event.
I want to share a comment. This is not a question, it's a comment, but I think it's worth. Somebody said, you know, I was more than prepared. My programs were beefed up. I thought I was ready until this presentation. More to do. And I think that's a common theme and that you'll all will find. I mean, I think you probably have all enhanced your programs, but again, challenge your program. So I appreciate that comment. Peg, this one is for you. It says, Judy said food and beverage only. Does this not include warehouse?
Okay, it is for everybody in the supply chain for the food and beverage industry. So that includes manufacturing sites, that includes warehouse and distribution, that includes packaging manufacturing. So everybody that's in that supply chain for the food and beverage industry is included in the standard.
Fantastic.
Oh, did we just lose Judy?
Sorry, can you hear me?
Okay, we can hear you now.
I'm sorry. A lot of folks are asking about, is there handouts that they can go through and be prepared for the records? And yes, we will provide that. So please send your email over to the ppc@aibinternational.com. Folks are saying, where can I purchase the standard? Where can I find the standard? And again, all of that information, just send your information over to ppc@aibinternational.com, and we will get you started with a nice package that'll get you started. And a lot of folks are just saying very nice things, and I'm always grateful for that. Questions about again, how often? And I really believe that was the last question. And I could be wrong. If we have missed a question, and truly our intent is to answer as honestly, as transparently as we possibly can. If I have missed a question, we will follow up with you and make sure we communicate with you and answer your questions.
Hey, Judy, this is Steve. I do have one question. You mentioned
Please.
that an audit might be virtual. Can you talk a little bit about how that might work?
You bet. That's a great question. Thank you. So we've actually done tests on this both ways. We've done the virtual assessment, which I'll talk about in just a second, and we've done the on-site. And what we have found is so much of the records and programs can actually be reviewed virtually. Now, I will tell you, on the virtual piece, we will call upon we will call on some specific employees that will ask to be interviewed. So let's say, for example, you have on your crisis management team, again, Stephen, you're on the crisis management team, but you're not in the meeting room. I want to interview Stephen. I want to talk to Stephen. I want to make sure that, you said that you met just last week. I want to talk to Stephen and make sure you've met, last week. So although it's done virtually, it does require, you have to do some footwork, if you will. So you may have to go get Stephen so I can interview that employee, but it can absolutely be done virtually. And the reason for that, why we give you the choice is completely up to you. Some of you prefer it on site. Some of you prefer it virtual. We recognize that there's still a huge risk. There's hotspots still in areas. So we recognize that there's a concern that, you may not see us as essential, but yet you still want the certification. That's the reason why we're offering the virtual. But it does require some work on your part also. Here's one thing that I'd give you some advice, okay? If you decide that you want to move it virtually, bring one thing with you, and it's called your patience. And I really mean this, because it does take a little bit longer. It does, you sometimes have, just like you saw that I lost the internet for just 1 second, only because the power went out here, I think. So you do have to bring your patience, but I promise you it will work very, very successfully. Thank you for the question, Stephen.
So, Judy, did we have a couple new questions that you might want to hit on, or should we wrap it up?
I think it's just folks are just saying some fantastic things. So again, if I may thank you again, Stephen and Amy, the group with AFTO has been truly the most professional organization. It's been a pleasure working with you. I look forward to continuing this wonderful relationship. And thank you so much to all the companies that provided us their crisis management plans, that went through the interviews with us. I mean, really and truly, I think we have a great product for the industry because it was developed by the industry. So thank you all so much.
Well, and thank you all very much for participating and presenting today. We appreciate the opportunity to provide more information about this program as an example of something that people can do to be more prepared for future pandemics and hopefully maybe COVID-19 also as we go through the fall and winter. So thank you all very much and have a wonderful afternoon.